But when we talk about coaching relationships, so a coach and a coachee, these are kind of the big boxes that we think about. And this is the lens I think about with my learners as I'm assessing their quote unquote readiness for graduation. So technical skills exceptionally important, psychomotor, exposure, approach, use of both hands synergistically, all those things are important. But I also want to know about cognitive skills, decision making, judgment, situational awareness, and how am I actually evaluating those things? And how am I pushing them to the limit to be able to evaluate those things in a safe and supportive space? I want to look at self regulation. So, what are my learners doing in regard to stress response, coping strategies, interpersonal skills as well, right? So, how is my resident or fellow communicating with anesthesia? How are they communicating with the scrub tech? What is their leadership in the OR? Do they have a presence in the OR? Are they making people feel like they're being seen and brought up with them? Or are they talking down to their team and teamwork? And these other areas are very hard to evaluate in the current system that we have with residency and fellowship, I would argue. And so this is a space where I think surgical coaching in general can really supplement our current trainees and really bring us to the next level. Not that teaching is not important. Teaching is exceptionally important, obviously, but it feels much different than coaching where there's a flattened hierarchy, meeting your learner where they are and helping raise them up to their ideal state and closing that gap. And so what studies have shown is that this space that we're talking about with interop decision making, failure to regress, right? Like sometimes you watch your own videos, if you watch your own videos, and I'll see myself doing lots of movement, but like nothing's actually happening. And I'll be like, what did I just do for 10 minutes? Like, did anything even happen? I swear to God, I was working, but nothing actually happened. And having a two-way conversation around that space, that's where real progress is made. And so I think it's really a really beautiful, sweet space of being able to have these conversations with our learners and tapping into these areas that truly make somebody ready for independent practice before they're out putting their signposts up for being a surgeon.